I want to discuss an exciting frontier in healthcare, and that is the utilization of patient-generated healthcare data for the creation of personalized healthcare tools, especially digital ones. We are currently witnessing an incredible revolution in healthcare. Digital health technologies such as wearables, mobile apps, telemedicine, and AI are transforming the way we access, deliver, and experience healthcare. This revolution is empowering individuals, and by individuals, I mean specifically the consumer and the patients like never before, placing them at the center of their own journey. In the past, healthcare was predominantly a one-size-fits-all paternalistic approach. Patients would visit a healthcare professional, tell them what their problem was in a very confined space of time, would receive a diagnosis and be prescribed a treatment plan. However, this model is rapidly evolving. Personalized healthcare is gaining traction, and it's thanks to digital health technologies that this shift is becoming a reality. So what does this mean for consumers and patients? It means they now have an unprecedented access to health information tools and resources to actively manage their well-being, whether that is disease-specific or just generally everyday health factors. They can monitor their vital signs, track their physical activity, and even analyze their DNA to gain insight into their unique health profiles, all at times that suit them and marry their needs. This newfound empowerment empowers patients to take charge of their health like never before. In the era of digital health, patients are generating vast amounts of valuable health data through various sources, as I mentioned before, like wearables, apps, patient portals, in addition to existing digital data streams such as databanks, registry data, and the electronic health record. This data, when harnessed effectively, has the potential to revolutionize healthcare by enabling the development of personalized healthcare tools. The role of the consumer and patients goes, however, beyond the use of these technologies. They are active participants in shaping the future of healthcare. By embracing digital health tools, patients generate valuable data that can be harnessed either for research purposes, and over COVID, we saw that this was predominantly in real-world evidence and decentralized research, and innovation. This data, when anonymized and aggregated, contributes to the development of these personalized care plans, the identification of new therapies, and the improvement of healthcare systems as a whole. However, with this empowerment comes some responsibility. Patients need to be equipped with digital health literacy to navigate the vast array of tools and information that we have seen explode into our app stores today. Patients should ensure that they're using reputable and validated apps, wearables, and other monitoring devices. It is important to understand how these tools work, calibrate them correctly, and follow the manufacturer's instructions. Healthcare providers, policymakers, and technology companies must work together to ensure that individuals have the knowledge and skills to make informed decisions about their health. So how do we take patient-generated healthcare data and transform it into personalized healthcare tools? Let's explore a few steps in this process. So firstly, data collection and aggregation are essential. Patients generate data through their interactions with these digital tools. This data can be an array of data, from passive to active data collection, from subjective to objective, and they can range from vital signs, symptoms, physical activity, sleep patterns, biological samples, and way more. Healthcare providers and technology companies must establish secure and user-friendly platforms to collect and aggregate this data, ensuring that the privacy and security of the patient information. Once the data is collected, the next step is data analysis and interpretation. Advanced analytics and machine learning play a crucial role in deriving novel, meaningful insights from the collected data that otherwise would have gone unnoticed. By applying these algorithms to patient-generated data, patterns and trends can be identified, leading to either personalized health recommendation, early detection of deterioration or novel health issues, and therefore optimized treatment plans. These tools may take the forms of various products such as apps, assistants, clinical decision support systems, or remote monitoring solutions. They can provide patients and consumers and healthcare professionals with real-time feedback, personalized recommendations, and actionable insights to help them make more informed decisions about their health. Furthermore, patient engagement and feedback are essential in the creation of these personalized healthcare tools. Patients and end users, like healthcare professionals, should have a voice in the development process, providing input on the preference, needs, and priorities. Engaging patients in co-designing these tools ensures that they are user-friendly, culturally sensitive, and aligned with individual goals. Through continuous feedback loops, patients can actively shape the evolution of these tools, fostering a sense of ownership and engagement and achievement in the evolution of healthcare. Collaboration and partnership are key in leveraging patient-generated data. Healthcare providers, technology companies, researchers, and patient advocacy groups should collaborate to ensure that this data is shared securely and ethically. These partnerships can facilitate the integration of patient-generated data into electronic health records, databases, and population health initiatives, driving improvements in personalized healthcare and fostering innovation. One of the key barriers to the utilization of patient-generated healthcare data is ensuring that the data quality, the data that is generated by the patient is of a high quality, for it's crucial for its effective utilization in personalized healthcare. Some of the strategies that one can adopt to ensure the data's quality and fidelity include clear education and training, providing patients with proper education and training on how to use the digital health tools and accurately collect its data. Validation and calibration is ensure that, just like traditional medical devices like a blood pressure cuff, that these tools are calibrated and validated regularly to ensure that the data being collected is reliable and consistent with the historic data that is being collected and its intended use statement. Standardized protocols for data collection help in not only reassure the patient that their data is being looked after and cared for in a manner that they would deem ethical, but also helps us allow for the analysis of multiple data sets that come from different sources, understanding their origins and their levels of validity. I mentioned it before, but the user-friendly interface, so the UX design of these digital tools, are paramount in clear engagement from patients to ensure that high quality data is being transmitted for whatever the reason. And the last one is data validation and verification, with continuous feedback and data quality monitoring, whilst encompassing data privacy and security, are just some topics on their own for discussion when we talk about patient-generated data. Let's consider an example of where personalized healthcare can be used via digital health technologies. Imagine a patient named Emily who is managing a chronic respiratory condition such as asthma. Emily uses a smart inhaler device that tracks her inhaler usage and sends the data to a mobile app. Emily's healthcare provider utilizes her inhaler along with relevant health information to create personalized healthcare tools for her asthma management. Based on Emily's specific data, a personalized healthcare tool could be developed in the form of a mobile app with the following features. Firstly, I've already stated she's got a smart inhaler, so the app could track the inhaler usage, providing her with a detailed history of how often and when she uses her inhaler. This would be paramount to understanding how Emily is managing her asthma journey. Is she on the verge of an exacerbation? Does she need to be up-titrated her medication? Or actually, is she doing really well compared to how she psychologically thinks she's doing well, by evidence of a decreased use of her inhaler? You could also add additional reminders and nudges and behavioral science technology to promote dose adherence to prescribed treatment plans. Trigger identification. Asthma is often a disease that has clear triggers, but sometimes those triggers have significant overlap with one another, and sometimes it's quite different to delineate between the two. With enough engagement from the consumer, Emily, as well as pulling data from, say, publicly available sources such as pollution levels, social media trends, you may be able to identify triggers that exacerbate her asthma. Over time, the app can analyze this data, and we move into the realm of personalized medicine to preventative medicine, i.e. get that person to be pre-diagnosis or pre-exacerbation before the exacerbation happens and intervene. Based on all the information above, engagement with a healthcare professional via this platform can help tailor-make Emily's personalized action plan for the management of her asthma. You can tie in more less frequent monitoring, so peak flow monitoring, which may not be done as regularly. There are lots of digital lung function testing tools out there that can integrate via API with mobile apps that can help her better track the quality and function of her asthma control. And lastly, and most importantly, is patient activation. So education and resources can be provided via the digital tool, and they can all be moderated by a healthcare professional to ensure that they are up to date and relevant for that individual, rather than the blanket, here is a pamphlet about asthma, of which 99% of the time it no longer relates to that patient. By leveraging this patient-generated healthcare data, such as inhaler use, trigger information, peak flow measurements, this personalized healthcare tool driven by patient-generated healthcare data enables Emily to actively manage her asthma, putting her at the center of her disease and therefore the locus of control. It offers tailored guidance, reminders, educational resources, and empowers her to just take control of her disease, make informed decisions, and shifts that relationship with a healthcare professional from paternalistic to being joint and being united. By engaging patients in the process and fostering collaborations, we can unlock the full potential of patient-generated data, driving advancement in personalized healthcare and eventually pushing the needle away from reactive healthcare to proactive healthcare, getting people, instead of seeing a healthcare professional to get a diagnosis, seeing a healthcare professional to prevent pre-disease and diagnostic states so they can intervene so people never get the disease in the first place. Let us embrace the opportunity to revolutionize healthcare, putting patients at the center of their own health journey. Together, we can create a future where personalized healthcare tools empower individuals to achieve optimal health outcomes. Thank you very much for your time.